hear you, we have to unmute yourself and you can start.
Do you hear me now?
Yes, thank you.
So, can we start?
Yes.
So, good afternoon to everybody, dear colleagues, dear participants. My name is Vera Katalinić Janković. I am Special Advisor to Croatian Minister of Health for Public Health and One Health approach. And I am very pleased to have the opportunity to moderate this event and to address you today on this very important public health topic. As pointed out in the invitation for this event, COVID-19 has globally shown that human, animal, and environmental health are strongly and unbreakably interconnected. The One Health approach is thereby more than ever an important issue for discussion and exchange of views. If we briefly back at 1946, when health was defined within the World Health Organization, we note that health as state of complete physical, mental, and social well-being, not merely the absence of disease and infirmity, has never lost its relevance. In Croatia, we are particularly proud of Andrija Štampar's legacy. This medical doctor, born in 1888 and passed away in 1958, was leading authority and the pioneer of epidemiology and preventive medicine globally. He wrote an introductory declaration of the Statute of WHO and was the first president of the organization. We are pleased to notice that Štampar's 13 health principles remain valid and are present in the majority of Sustainable Development Goals. National Public Health Institutes network in Croatia enables the implementation of health as defined by WHO. Numerous activities of preventive medicine, a whole range of laboratory and data analysis, health and environmental impact assessments are done daily among preventive medicine stakeholders in order to ensure complete physical, mental, and social well-being of our citizens. Interlinkages of climate exchange, biodiversity loss, and various pollution types, chemical, biological, and even physical, are obvious. As obvious are their impacts on economic and social development. Pollution represents a significant threat to community health worldwide. It includes not only the immediate acute consequences of environmental incidents, catastrophes, and sudden pollution, but also chronic post-exposure health symptoms and conditions, leading to the long-term public health and socioeconomic consequences. Similarly, environmental pollution may affect animal health, leading to a merger of new infectious agents. To address these issues, it is important to develop tools for comprehensive assessment of environmental health risks and hazards. In accordance with the One Health approach, a health strategy that encourages interdisciplinary collaboration and communication on health at the human, animal, environmental interface, as well as multi-sectoral risk assessment, represent a best buy toward implementation of 3 dimensions of the 2030 agenda. In Croatia, a wide range of environmental health indicators and monitoring programs are carried out as preventive self-assessment or obligatory monitoring at the local or state level. Strategic EU and global priorities are recognized and implemented based on the scientific data provided by public health institutions in Croatia and worldwide. In that context, Agenda 2030 represents an added value and opportunity to foster multidisciplinary ecosystems such as public health institutes for strengthening the role of the key health stakeholders in innovative growth and sustainable development. Multisectoral risk assessment principles represents a key pillar in further promotion of One Health approach and sustainable development goals. In Croatia, we believe that existing national capacities, the legacies, must be nourished to ensure a higher level of resilience in order to ensure better response to recognized and unrecognized emerging environmental health threats. Finally, to conclude, already in his time, Andreas Stampar, as a visionary, recognized this importance of the holistic approach towards health that One Health approach is actually all about. It is obvious that the understanding of need to address the health of plants, animals, and humans together has been there for a long time, but only since recently it is gaining its structure in the concept of One Health approach. And today we'll address through the lens of the pollution. And at the end of my introduction, I would like to inform you of some housekeeping rules. I kindly ask everyone to stay muted until given floor to speak. If you want to request the floor, please use the option of raising hand, or you can write in the chat and we'll do our best to monitor the request in real time and respect the order of interventions. Thank you very much. We'll move on. Now, I would like to invite and give floor to our first speaker today, Mr. Keith Sampson from Food and Agriculture Organization, Chief Veterinary Officer, who is more than 30 years active in the field of disease ecology at the interaction of wildlife, domestic, and the environment. Keith, please take the floor and give us the overview and the background on the interlinkages between health and the environmental.
Thank you very much. Thank you very much. It's a great pleasure to be here, and it's a really important topic that you're choosing to apply the One Health lens to today. I'd also speak on behalf of FAO as the current chair of the tripartite of FAO, the OIE, and the WHO, who together have been leading the One Health approach. The approach that we've taken for One Health so far has largely considered the importance of diseases which are infectious. I think what you're bringing in today is very much a wider perspective, and that's welcomed, relating to One Health and the importance of addressing, taking that approach to address pollution. Firstly, as you've said so well in your introduction, human, animal, and ecosystem health are interconnected and interdependent, and the environment is a key point for connection, both for introducing disease agents into humans and animals, but also affected by the contamination of the environment by humans or by animal agriculture or by other sources, including, for example, antimicrobial residues and resistant microbes coming from the treatment of animals, humans, and crops. Let's consider one of the areas where there is the great connection, and that is in terms of water. 2.2 billion people still lack access to water, and 4.2 billion to sanitation services, which makes them more vulnerable in times of epidemic diseases and to pollution, in part because water is so important to animal production, to obviously to human health, but also in terms of basic sanitation and prevention measures for COVID and other issues. Agriculture is widely recognized as an important source of water contamination, including microorganisms, and there are many pathways of pollution that can reach water resources. These include our cropping systems, waste from livestock and aquaculture, as well as from fertilizers, including manures applied to the land, pesticides, bacterial, microorganisms, and antimicrobial residues. The pollution of the environment can have a significant adverse effect on human and animal health. As an example, anthrax is a zoonosis that causes fatal infections in wildlife, domestic, and humans. And it can survive many years in the environment after cases. So we can consider that diseases can contaminate the environment and act as a source for many years to come with human health consequences. Another one would be infectious zoonoses such as E. coli 0157, primarily coming here from cattle, but often picked up through contamination of fruits and vegetables as a result of the use of animal manures and water. Another area might be the one of increasing concern over microplastics. Microplastics are ubiquitous in the environment, and they have adverse effects on both human and animal health, affecting them both, and may have a role in increasing the spread of pathogenic bacteria or of antimicrobial resistance genes. Another example of pollution affecting human, animal, and the environment is mercury as a result of combustion of solid fuels, gold mining, and other industrial processes. The concentrations of mercury present a great risk, both in water, where it takes a particularly toxic form that is absorbed by aquaculture, resulting not only in fishery problems, but also in terms of human exposure. We've mentioned antimicrobial resistance. The environment is an important one there because the entry through various forms of pollution of antimicrobial resistant bacteria is really an important way in which the environment can be affected and also lead to an increasing exposure of humans, particularly in countries where sanitation is relatively poor. FAO has been developing and advocating the One Health approach, extending that work really beyond the lens of zoonotic diseases and antimicrobial resistance into areas including thinking about the importance of water and how water is central. And so we may use the term One Water, One Health. As chair of the tripartite in this current year, we're also pleased to be working increasingly closely with UNEP to develop a common global plan of action for One Health and the tools to apply this approach to not only the major priorities, which are seen very often as zoonoses and AMR, but to other areas where One Health will be important to apply through having common tools and approaches that are multidisciplinary and multisectoral. The effects of the health impacts of pollution have to date not really been seen as a major focus for One Health, but we're really glad to see that you have raised this possibility, this attention, and the fact that it does affect humans, animals, wildlife, and the environment. Pollution has the potential to affect all life and requires, therefore, a wide, multisectoral, multidisciplinary approach, but also very much a focus on the things that can be changed, which will benefit all. FAO's One Water, One Health concept is a relevant approach as it focuses on one area of major concern and shortage, and that is water. It's an integrated water resources management approach. And increasingly, we're seeing One Health being applied to the areas of natural resource use, including land use, because of the consequences and the risks associated with how land or water is used for the health of all. Building on this One Health approach, recognizing the central position of agri-food systems to health, considering that all stages of our agri-food system have an impact upon health, with the increasing focus that we have on ensuring that the work that we do as FAO on agri-food systems is done in a One Health approach, considering the impacts of our food systems on the environment, but also human health. We would really say One Health is for all, and all life really does depend on us adopting a better One Health approach to dealing with major problems such as pollution. Thank you for this opportunity to speak to you today.
Thank you very much, Keith, for a very interesting and comprehensive and informative presentation. Now we'll move on and we'll hear from the perspective of the policymakers as well as the representative of the academic community. And our next panelist, Mrs. Veronica Manfredi, Director for Quality of Life at the Directorate General for the Environment at the European Commission, dealing with EU policies towards the zero pollution and the effective management of water. So, Veronica, please, floor is yours.
Many thanks, first of all, Mrs. Katalinis, for this really appreciated invite. It's a pleasure to be able to come to you with, I would say, what is a very pragmatic, latest policy development from the European Union perspective to tackle this challenge of the One Health approach and be sure that we engage in a truly transformative agenda, because what we feel is also a remarkable urgency and pressure to act to cut pollution. I prepare for you a quick PowerPoint presentation in the hope that it can help focus everyone's mind. I know it's still only afternoon on your side. Here in Brussels, we are already coming to rather late-ish evening, and I will try therefore to display the screen. I hope this will work. Okay. In principle, you should now see my screen. Can you see it?
Yes, we can.
Fantastic. Many thanks for that. So let's start. I was referring to the EU Zero Pollution Action Plan for Air, Water and Soil, which has been adopted by the College of Commissioners last May the 12th, and it's a subtitle. It's essentially what we're talking about tonight. This is a pathway to a healthy planet for healthy people. And I think the pertinence of this topic in the midst of the ongoing fight against the COVID-19 pandemic, I think it doesn't necessitate any further words. The reality is that our planet is currently facing 4 intertwined ecological crises, and they all reciprocally exacerbate each other. One is climate change, the other is the biodiversity loss, the other is the unsustainable use of our resources, and we have the pollution. What we know is that basically we have the same kind of anthropogenic activities that at the same time generate a large amount of greenhouse gas emission that are then mainly responsible for climate change and also responsible for pollution. So in particular, the intertwined play between the two is really to be stressed. The urgency to act, as I was referring to, is self-evident. Even in the European Union, that of course prides itself often to be, at the forefront of the fight, we continue to witness every year the fact that 1 in 8 premature deaths are linked to environmental pollution. What you see in this slide is the fact that the first cause of this premature death remains, unfortunately, cancer. This over 250,000 figure represents around 25% of the total number of cancers recorded every year in the European Union, and this share, this 25%, is linked to pollution. As you can imagine, mainly air pollution, but also, I must say, the presence of toxicity that percolates through water and soil plays an important role. What we know is also that this pollution indiscriminately affects the most vulnerable groups, be it children, even at fetal stage, people with medical conditions, elderly, and those living in poorer socioeconomic conditions. So what we're talking about is really an agenda of social fairness as well. The health inequalities between and within states are shockingly entrenched, even in highly developed regions of the world, because we see that really worldwide, it's the lower and middle income countries that bear the brunt of pollution-related illnesses. This is a global problem. This slide, which I took the liberty of taking from a recent report of the Global Alliance on Health and Pollution, shows you the number of pollution-related deaths globally. The bigger the circle, the higher the intensity of the pollution issues. So I don't think I need to comment. And here, where you see the African red car map, it's a visualization of lead pollution as such. Now, this is why when our President of the European Commission, Mrs. von der Leyen, took office back in July 2019 and presented their political priorities, we were really extremely happy in DG Environment to see that she wanted to have this precisely One Health agenda, an agenda that looks at solutions to raise the health of our citizens by addressing air and water quality, hazardous chemicals, industrial emission, pesticides, endocrine disruptors. This agenda became reality in the European Green Deal that we adopted back in December 2019, where none of us had the slightest clue that the pandemic would have hit the world the way it has, just a couple of months down the road. And the zero pollution ambition was then reconfirmed there as an important deliverable and something that indeed has seen the light 1 year after the adoption of the European Green Deal, together with the chemical strategy for sustainability. What is our vision? Our vision is not an utopian vision of going towards, a complete mathematical zero that, as I always like to stress, would be even at clash with the vision of life on Earth. This is a social, economic, and moral agenda for securing that at the time the European Union is engaged with so many other countries in an agenda for climate neutrality, that we choose technologies and natural solutions that progressively bring air, water, and soil pollution to levels which are no longer expected to be harmful neither to human health nor to natural ecosystems. Basically going back to respect the boundaries of the level of pollution that our planet can cope with. This can help us build a toxic-free environment. I apologize for this slide because I have noticed only when connecting that unfortunately you cannot see on it for a technical issue the targets, the 2030 targets that we have set in the Zero Pollution Action Plan, but I can briefly refer to them. They speak about cutting by over 55% deaths related to air pollution. And this is, for example, a target that is really linked to a very robust implementation of our acquis. But I was pleased to listen to the previous speaker from the FAO, microplastics, plastic pollution. These are all part of our 2030 targets that, as I repeat, have been fixed by basically taking into account that by now we dispose in the European Union of a very robust regulatory framework that, if well implemented, can help us reach indeed or puts the European Union on a good path towards reaching the Sustainable Development Goals and truly securing that we stick to the diagram that you see here. First, protection of the biosphere as a quintessential basis for securing societal and economic development. The hierarchy of pollution needs to be truly reversed. The Treaty of the European Union already binds all of our member states and ourselves, of course, to prevent at source. The reality is that our economic and societal models have been such that this principle has not necessarily been as well implemented as it should. And the Zero Pollution Action Plan really comes with an agenda of regulatory actions, legislative revisions, next to a transformative agenda for change that wants to put truly prevention, polluter pays principle much more at the forefront. How? Well, of course, by looking at all sectors of the economy, which are the main responsible for pollution. I think, of course, of mining activity, industrial production, energy, mobility, agriculture and fishery, consumption and production, of course, as we said, more in general. The structure of the document is very simple. I would dare saying we had only 20 pages to come up with really a strategy that was targeting the key things to do. It rotates around 3 thematic areas, so 3 areas of key goals: improving people health, living within our planetary boundaries, and this is our One Health concept really, securing therefore this zero pollution production and consumption. How? With the 4 enablers that you see in this slide, which go from boosting change across society. This is a chapter that deals with our skills agenda, with our finance agenda, with our, I was going to say, yes, of course, employment, job creation agenda linked to the new jobs of the future, and the digital agenda that today enable us to visualize data in such a more compelling manner that it becomes easier to display to policymakers at all levels, including at local level, you know, mayors, presidents of regions, at a very, very granular manner, not to mention, of course, the direct empowerment of individual citizens, where to act, because there is a need to act, but also which type of solution to choose that for the same euro pay you back in improvement at the same time on cutting pollution, say in air, reducing greenhouse gas emissions, possibly greening your city, your headquarters, and so on, and obtaining therefore co-benefits also from a social perspective. The second enabler is an enabler of securing better implementation and enforcement. And in not only, of course, very important always, not only the role of the European Commission as guardian of the treaty, bringing its member states to court if they really don't abide, but it's also very much an agenda of supporting and stimulating further implementation action at national and local level, also by empowering better both citizens and authorities. It's an agenda promoting worldwide change. We will zoom into that in a moment, because this, I think, is what interests us the most tonight in discussion with you, how we can create also worldwide synergies in transforming the way we live collectively on this wonderful planet, and of course of tracking the progress that we make. I like to repeat, nothing that you put on paper that you cannot measure is ever really useful. And we have created with this agenda really an agenda of measurability. I will show you how in a moment. Well, to implement, we saw to ourselves that we needed as a first thing to really break the silos between people that, you know, each tend to look at one part of the story. There are the specialists of air quality, the specialists of what happens in our water, including from a broader water management perspective, the specialists of food, the specialists of digital. We need to bring people together. And one way to do it is, for example, to work together towards reducing health inequalities. President von der Leyen has in the Europe's Beating Cancer Action Plan already launched a cancer inequalities register that essentially is looking as to whether there is a convergence between the particularly acute and persistent appearance of certain typologies of cancers in, let's say, possibly also poorer areas, or, you know, linked to certain type of dietary consumptions, etc. And we thought that this idea was so interesting that we should have also secure that progressively the data on pollution feed on the one hand this cancer inequalities registered, but also enable us to progressively understand whether we can also cover more data on other health diseases that are linked to pollution that possibly need also a more local handling. We want to support urban zero pollution, and here we have created an ad hoc platform which is called the Green City Accord, that mobilizes actors across different municipal levels. And of course, we work across several, let's say, platform of cooperation with the cities and region. We are working hand in hand with the colleagues of the Committee of the Region to promote zero pollution across regions as such, and help again the regional authorities to track progress made, facilitate zero pollution choices, enforcing zero pollution together, showcasing zero pollution solutions for buildings, a particularly important domain those days, because as you may know, we've also launched last year a new European Bauhaus concept, which essentially is a concept of bringing together best architects, engineers, urban planners to devise solutions for our urban environment to cut greenhouse gas emissions, but also...
Veronica, sorry for interrupting you, and because time is running so quickly, and you gave us you gave an excellent overview of the pollution as a global problem and EU position, and of course the directions to be taken. So thank you very much again.
Thank you.
So thank you. We'll move to the next speaker. If Professor Sun Boy is connected.
Yes, hello.
Oh, hello.
Can you hear me?
Yes, we can hear you. So let me introduce and invite Professor Yang Sang-soo from Cancun University, Republic of Korea, who is governing International Union for Air Pollution Prevention and Environmental Protection Association. And Professor, please take the floor. And thank you again. You get up very early in the morning. It's middle of the night in Seoul. So thank you again. You join and share your time with us.
Yes, hi. First of all, can you see my PPT screen? Okay, great. Again, thank you very much for inviting me. It's a great honor to be able to participate in this forum. I was especially excited to see that Croatia is the actual producer of this event, because as you mentioned, the IUAPA organization, which I am the Director General of, the International Union of Air Pollution Prevention Associations, Croatia, the Air Pollution Protection Society of Croatia is a member of our union. And I am very familiar with the president of the union and the Croatian organization, Gordana Panek. I don't know if you know her, but and we are actually going to have our board meeting during the Croatian Air Protection 2021 conference, which will be held in September in Medulin. So again, a lot of relationships there. As you mentioned, it is a little past 2 in the morning in Korea. So I consider myself to be quite a late person and an evening night kind of a person, but this is a little extreme. If my voice is a little down, please forgive me for that. And since I've only been given 5 minutes, I want to get right to the talk. But before I mention the actual subject area here about the One Health approach, I would like to sort of tout our horn, if you will. The Korea, as you know, are the principal organizers of the CABS, the International Day of Clean Air for Blue Skies, which is the UN day to sort of celebrate clean air. And we were very fortunate to be able to get it past the UN situation quite, expeditiously. And also, the Korean government is very keen on the Green New Deal and the Digital New Deal that the government is proposing. Turning now to the One Health approach, again, let me, okay. I'm going to talk mostly about air pollution, which is sort of my area, and then Korea's approach to that. As far as air pollution goes, we have dealt with this one atmosphere approach or One Health approach for quite a long time. Obviously, we're talking about a very comprehensive, integrated approach. Air pollution itself is very integrated. As you're well aware, we disregard all kind of boundaries, or air pollution disregards all kind of boundaries, natural or political. And we have problems of air pollution where you go from dealing with air pollution from one city to that is affecting the rural communities, air pollution from one country that is affecting another country. We are always dealing with air pollution that is coming from, for example, China, the fine dust problem that coming out from China, or even the yellow sand problem that comes from China. And since air pollution is such a integrated, non-boundary kind of approach, we are very familiar with this one approach, if you will. So the One Health approach is very appropriate in the atmospheric arena itself. As our previous speaker mentioned, air pollution and climate change is also very integrated. We also need a one approach for the problem of solving air pollution and climate change, because as you well know, that the cause of air pollution and climate change are quite similar. One of the most interesting aspects of this area is the SLCF, the short-lived climate forcers. These pollutants that are air pollutants and also climate change forcers. They're dealing with like black carbon, ozone, the HFCs and so forth, methane, and they're being treated by the CCAC, the Climate and Clean Air Coalition, which is a UN organization, which I'm also a member of. As far as air pollution from like industry that is affecting communities, we have the integrated environmental management approach, which is being taken up by Europe, the United States, and most of the countries in East Asia also. It basically means an integrated approach to environmental management of companies' emissions, industrial emissions, taking into consideration all sorts of media together, the air media, the soil media, and the water media. Indoor and outdoor pollution is also in this category. The necessity of the One Health approach, environmental policies is very integrated, like I said, it's very multidimensional. A lot of times we treat environmental problems in a one-dimensional capacity, and I have an example there on the screen of the MOEK, the Ministry of Environment of Korea, where we had a policy called the volume rate garbage disposal policy. It was very effective for solid waste management, but it was problematic for air pollution for a long time, especially in the early stages of the policy, because a lot of people were simply burning the solid waste in order to not pay for the amount of volume that they had. We have so many other examples where trying to solve one problem in one area of the environment would cause a relapse in another area of the environment. You have to look at it together. You have to look at it as a whole. You'll need a one approach, a total approach, a sort of a systematic approach to the entire problem. We also have to consider the time factor. The LCA, I don't know, maybe most of you are familiar with the LCA, the life cycle assessment. Basically, it's treating the environmental problem from the cradle to the grave. So, you know, a problem where you think about electric cars as a solution to the air pollution problem, but where does the electricity come from, and so forth. As talking about assessments, I think the One Health approach is very apropos to air pollution, because air pollution assessments were mostly emission-based. Historically, it was mostly emission-based in the beginning. How much was coming from the tailpipe of the automobiles, how much is coming from stacks and so forth. Then it sort of transformed into a concentration-based problem. How much do you exceed a certain standard that is set up by the country? But now it's a very health-based approach. We're worried about how much it affects the health of the people, of the population, how much exposure. We're talking about like the receptor-based problems or hotspots. So it's the One Health approach is very apropos to the air pollution problem. Connecting a little bit finally on the COVID problem that we are all suffering from. In Korea's standpoint, the particulate matter pollution, or the fine particle pollution problem, actually helped us combat COVID a little bit, to the extent where the mask wearing culture was very prevalent in Korea. And it was very easy to sort of transform to that. compared to the fact that like in Europe or the United States, people were very against wearing masks, for example. The health problem was very made very aware in the sanitary problems like the masks and the washing of hands, preventing the common ailments like colds and stuff. We had some bad cultural habits that are still going on, of like passing of drink glasses during parties and stuff, and using one stew bowl per dining table, or many people sharing the same food dish. So obviously these kind of habits are sort of being looked down upon because of the COVID problem. But most of all, I think it was very important. Biggest lesson that we learned from COVID was the fact that it is one health for all countries. Basically, just having a healthy Korea is not going to be enough to have to actually be healthy for all the world. I mean, we need to travel, we need to associate and integrate with our peoples. And basically we're all one earth, we're in the same boat, and we need to do our part. So in summary, this One Health approach is very important from an air pollution standpoint. It's very important from the Korean standpoint. I think we need to discuss it and expand upon it a lot more. And I think this forum is a very good start to the entire problem. Thank you very much.
Thank you very much, Professor Young. This was an academic perspective and insight into the topic. So thank you again, and probably see you as a tourist in Croatia in the autumn. Okay, now then we'll move on. Our next panelist is Mr. Benjamin Roche, Research Director at the French National Research Institute for Sustainable Development, within experience all over the globe regarding evolutionary ecology of infectious diseases. So Benjamin, floor is yours, and thank you to be in time frame, please.
Thank you everyone for the invitation to this very intriguing session. So indeed, so we know that, as it has already been mentioned, we know that human activities, which may have a lot of manifestation, and especially pollution, has a lot of direct impact on human health. It has been just said by my colleague. However, it's also crucial to take into account that human activity may have also a lot of indirect impacts on human health. Indeed, this manifestation of human activities can impact animal health and ecosystem health, and therefore, consequently, human health. I think one of the most striking examples is definitely the emergence of infectious disease. Since decades, many zoonoses have emerged, like Ebola, MERS-CoV, the first SARS-CoV, HIV, avian flu, etc. Scientists were saying that one day one zoonosis will not be controlled efficiently enough and could lead to a pandemic. So last year, this is what the WHO called the disease X. Today, this is probably what we are calling COVID-19. So even if the scientific knowledge is not 100% perfect on that topic, and that all pathogen emergence are not necessarily linked to that, the association between human impact on ecosystem and zoonosis emergence is pretty clear. When we impact our ecosystem, we disrupt this unstable equilibrium that drives interaction between animal species, which may increase pathogen circulation within ecosystem. Meanwhile, human activities driving pollution, for instance, such as deforestation, put also human population closer to animal species that are themselves increasingly infected. So it means that we have a perfect cocktail for a given microbe to jump to human populations. And this has already happened a lot of times during the last decades. So we've seen with COVID-19 that we cannot just wait that a microbe jump on human population and trying to control its propagation. We need to do that, we need to be prepared, but we need also urgently to develop real prevention strategies to avoid such events. So the main issue is that human activities impacting ecosystem is also strongly linked with economic activities, and especially food production and food security safety. So therefore, we need to envision sustainable strategies that can lower the risk of zoonotic emergence and ensuring a correct level of economic activities, especially in low and middle income countries. So for instance, we are running an example like that in the peninsula of Yucatan in Mexico. So in this part of Mexico, which is one of the poorest states of this country, we are monitoring the dynamics of different ecosystems with different level of human activities and environmental protection strategies that have been implemented. So within each of these sites, we are collecting mosquitoes, rodents, birds, and bats, as well as sampling human population, in which we are screening a lot of different viruses that can lead to an epidemic. Then we analyze how the transmission networks between animals and humans can be impacted by environmental protection strategies. And so now we are working very closely with the government of the Yucatan state and also with the federal government of Mexico to try to implement the first One Health prevention strategies against zoonosis in this peninsula of Yucatan in order to provide to the world the proof of concept that environmental protection can indeed be sustainable with the goal to decrease the probability of zoonosis emergence. So the other problem with such issue is that this kind of prevention strategy need to be implemented at a worldwide scale. We saw that with COVID-19 that has started at the end of December 2019 in Asia, and less than 4 months later, the whole world was in lockdown. So it can spread very quickly. So it's important that this strategy are implemented on the ground and through the world, and so also to be adopted by authorities. So to this extent, the international initiative called PRESOD is an excellent illustration. It has been initiated by the French President Emmanuel Macron during the last One Planet Summit in January 2021. And this initiative already received the support of FAO and European Union. So with a budget of 200 million euros for the next 5 years, this initiative has 2 main objectives. First, improving epidemiological surveillance at the interface between animal and human populations. And second, envisioning methods of socio-ecosystem management that can mitigate the risk of emerging zoonoses while ensuring economic activities. Importantly, this initiative is currently designed for a co-construction process developed within 11 regions across the world in order to set up a strategic agenda of this initiative that can match perfectly the need on the ground and that can be adopted by the different sectors of local society. So to sum up, human activities are impacting the fragile equilibrium that links ecosystem, animal, and human health. So the science is making progress to offer concrete solutions to government and society, and this could be done only through this One Health approach. Thank you for your attention.
Thank you very much, Benjamin. Very interesting indeed. My background is a clinical microbiologist. I was personally interested to hear all these interesting things. Thank you.
Thank you.
And our last panelist is Ms. Maria Cristina Zucca, who leads the Pollution and Health Unit of the Chemical and Health Branch Economy Division at UNEP.
Thank you very much.
The floor is yours.
Thank you so much. I will try to also share my screen to show a brief presentation. Can you see my screen? I hope, can someone confirm if my screen is on?
No, we don't see it.
You don't see it, okay. Let me try again, and if not, I will just do without. Yeah, no. What about now?
Yes, we see it now. Thank you.
Thank you. Okay, so we also see in UNEP pollution as part of a set of major planetary crises, so very closely aligned with the EU Zero Pollution Action Plan. We see pollution very closely integrated with climate and biodiversity. And in the next years to come, UNEP will focus strongly on these priorities, their interlinkages, and the underlying unsustainable consumption and production patterns. The report that you see provided here is a synthesis report of many assessments, which provides a sort of a blueprint of the main issues that need to be addressed. I will not go into details. Everybody has spoken about the impacts of pollution. This is focusing mostly on health, but I just maybe go through a few that have not been mentioned. For example, the impact of air pollution also on plant growth, forest, lake ecosystems, which also impacts, for example, fish and organisms in them. Waste disposal, very crucial for many aspects of health, but it also includes potentially contributing to the spread of vector-borne diseases. For example, plastic that is not properly disposed of, can accumulate water and then produce this problem. There is a growing evidence of impacts of pollution on mental health, including from various forms of pollution, also chemicals affecting brain development, for example, lead. And then, of course, pollution has huge impacts on world economies, especially poorer economies, and it has an impact, a stronger impact on the poor and the vulnerable. It also has strong impairment on human rights. It exacerbates inequalities. You see here just an icon representing a small video that we have done showing how every aspect of pollution is linked potentially to human rights. I'm not going into details for this but I just would like to stress the fact that pollution action can actually advance progress on each and every SDG. At the same time, implementation and achievement of all SDGs basically virtually can promote pollution prevention. Reducing pollution is also important, especially it has emerged as important in the context of a pandemic, for example, the COVID-19 pandemic, because we have seen some interactions between health problems associated, for example, with exposure to air pollution and the health outcomes from COVID-19. There are many other linkages, for example, the use of wastewater surveillance systems to detect early the presence of the virus. And also, of course, the importance of WASH for the measures to tackle the pandemic. We have identified many linkages between COVID and environment. You just list here of linkages, but for sure there is much more that can be found, especially by using a One Health approach. Already Keith has mentioned the links of environmental considerations with AMR, so I'm not going to go into details with in these slides, which shows different ways in which the interaction occurs, all of which are actually potential targets for intervention. So I'm just moving now to express what has already been said, that pollution, by being an impact, by providing impacts on the environment and on health, it is basically One Health approach. It cuts across the people and the animals and environmental and plant health. In Europe, we have several mandates to address this link between environment and health and pollution. I'm not going to go into details, but we have been mandated to work on several aspects. One of them is the environmental dimension of AMR. Another one is pesticides and fertilizers, and you see an early version of this second report. We are working on the one on AMR. And it identifies the resolution that I'm referring to now to many actions that also member states and other stakeholders should undertake, including, for example, in the context of AMR, better waste management and wastewater treatment. On pollution specifically, UNEA, which is our Environment Assembly, UN Environment Assembly, has adopted many resolutions addressing many different pollution issues. But we also see the need to create a common narrative across all of these. And this has been done through an implementation plan towards a pollution-free planet, which basically identifies common gaps, common capacity gaps, common needs across any pollution, all pollution issues, which are represented by these boxes. Now I'm moving to the final slide, where I'm bringing again these boxes just to show how a One Health approach, which is focused on collaboration and on synergies, can actually address all of these areas, which we call capacity gaps, but they're also action areas. For example, we need to better understand, improve knowledge on the links between human, animal, and ecosystem health, particularly on aspects such as pollution, which have not been traditionally addressed that much under what is in place for One Health collaboration. Similarly, integrated surveillance, data sharing, and integration across these different sectors is key. In terms of implementation, multi-sectoral initiatives, for example, ministries coming together to address certain issues is key, as well as, of course, implementation capacities and then relevant frameworks. In terms of infrastructure, one area that we see needs more investment is using nature-based solutions also to address pollution, not just climate. For example, in terms of water treatment. Similarly, the role of wastewater treatment for surveillance is also something that requires investment in infrastructure. Professor Sumo mentioned the International Day of Clean Air for Blue Skies. This is a great example of awareness raising. It's not just about awareness raising, but it's also about bringing cooperation among countries to address, to improve clean air. Information for consumers, extremely important, knowing what is in the products we use, including, for industry and agriculture, stakeholders, and so on. In terms of leadership, of course, there is no end to what can be done in terms of leadership, but for example, industry standards and political prioritization of pollution reduction, and also recent outcomes, for example, or discussions ongoing in global fora such as G7, G20, and so on, supporting One Health are extremely important. So I will stop here. Thank you very much.
Cristina, thank you for your contribution. It was really great to hear you. As we have consumed time for reaction of the panelists, and I interrupted Veronica, so I would like to ask her to answer one question. Pollution is a global problem in adding to fighting it within EU. How does the EU work together with partner countries to address it more effectively? Veronica, could you like to ask this answer? Would you like?
How much time do I have to reply?
It's up to you.
No, it's simply because, I could continue forever. We work both through multilateral fora, and of course, I was very, very happy to see colleagues from the UNEP with us tonight, FAO, WHO, the entire, multilateral fora that are led by the colleagues of the United Nations. We engage bilaterally. We have ad hoc agendas for the neighborhood countries. So the opportunities and modalities of cooperation are multiple. And as you know, this cooperation often also comes with support, both financial one and capacity building. So we tend to exchange a lot of best practices. I happen to be also the director in charge for water management, sustainable water management for the European Union. I can tell you that we learn a lot from each other, Israel, Singapore, South Korea as well. Plenty of exchange of experiences to become all better in more circularly managing water and also becoming stronger vis-a-vis climate change impacts. So thank you.
it was really short. Thank you again. And now we'll open the floor to the participants of the event for the questions, and start with Mrs. Shilpa Pulela, Counselor, Permanent Mission of Australia at the UN.
Thank you so much. Can you hear me okay?
Yes.
Wonderful. Thank you so much to the panel, even in the sea of HLPF events that are taking place this week and next. I do think this remains one of the most crucial issues, and it's clearly an ongoing challenge for all of us. The One Health approach has, of course, seized the minds of policymakers and scientists and government officials all around the world. The organisations based in Geneva and Rome, of course, have their specific roles to play, and negotiators in Geneva, I think, do a lot of the hard yards in terms of hashing out language for resolutions and political declarations. And of course, governments are grappling with this domestically as well. So my question for the panel is, where does New York sit in all of this? How can we based here be useful and push the agenda forward, particularly as it relates to pollution, without duplicating the good work that's happening elsewhere? Thank you.
So somebody of the panelists would like to answer the question? Maybe Keith?
Thank you very much. No, I'm not sure I can really answer that question. I think it's quite a difficult one. I'm not based in New York to be able to specifically see the difference and see what the specificities are. I mean, perhaps the only thing I would add to that is that you know, because of the nature of, we're talking here about truly multiple UN organizations and non-UN organizations having a role in some of these areas which are, you know, truly are affecting all of us, then you know, there can certainly be a need to ensure that at the highest level of the UN, that there's an understanding that it cannot be left to a single agency, and there is a need to be able to hear us together and see us working together. And some of the examples that come from that. I mean, for example, in One Health, we really do believe that AMR has been a good example of a multi-partner approach in which funding of the agencies to work together has really been driven by, let's say, from from that end. And that might be applicable to One Health as well, so that the agencies again are working together, are perhaps funded to work together through multi-partner trust fund approaches, because, you know, we are to serve countries and to see country level transformation, and rather than our own agencies doing it one at a time, it's much more efficient if we're working together. Now, some of those things from UNDP and from New York, some of those initiatives at New York end would actually help us in giving us the modalities to work together. And so very much at the moment, we're working on the idea of a common modality for funding One Health. And we hope that that will be supported from the New York side. Thank you.
Thank you, Keith. Christina, could you add anything to this question, please?
Thank you very much. Yes, I fully agree with Keith, and maybe I could add the element of promoting the importance of pollution in the context of Agenda 2030. Although it is the specific objective of some of the goals, it is not necessarily explicitly reflected in all. So there is a bit of a danger that also in terms of you know, countries' efforts in reporting and also national level support from the UN system as a whole, that it doesn't fully you know, strongly address these priorities. So I think New York can play a role in that sense. And then building on the previous intervention, the importance of the UN coming together For example, this is not really a New York related thing, but the EMG, the Environment Management Group, is an interagency coordination group based in Geneva. But of course, it's related to broader interagency approaches in New York. And we have provided a proposal from UNEP to create a system-wide approach to pollution. It's still just a proposal. But this is an example of just basically leveraging the full potential of the UN system, of all agencies who have a lot to do, even if they're not explicitly addressing pollution. They have a lot to do to prevent it. Thank you.
Would anybody else like to react? If not, I would like to ask, what do you think if the One Health approach has enough or should get more visibility within the UN, and how to achieve that? Who would like to answer? Okay. Would you like to answer? Maybe Christina or Veronica?
Well, if I may offer just some thoughts, because of course I would describe ourselves as at the same time actors and clients, so to say, of the really valuable activities which are carried out by the United Nations. For me, the point is really to how to manage to ultimately drive a change on the ground as well, which is always a challenge for large organizations, and I would say also for us, European Commission, fantastic, but how do you really change on the ground? And actually, I would like to hear from the panelists, from their concrete experience, how much they still feel that there is a need for making sure that ministries of health, ministries of environment in their different countries really cooperate together on an agenda of better prevention. That also must be an agenda of raising people awareness about the risk of choosing certain products versus others, the risk of toxicity, but also an agenda of concrete solutions, what can you do, and how to engage also with the industry in order to press towards really needed urgent changes. This is the type of things that I would like to see ultimately the One Health approach bringing. And I think it has already brought quite a number of deliverables. We can also not underestimate the importance of the approach. Honestly, it has been really an important driver, but still I see so much to do concretely on the ground that I think, people have to really be brought together. And sometimes you reach more maybe with good communication, also some stories told in a simple manner that citizens can easily grasp with and that can mobilize, drive really a change. Thank you.
Thank you. Professor Jung, would you like to share your follow-up thoughts with us?
Sure. I would like to, this whole approach of One Health means working together. I mean, the health sector, the environmental sector, the academian sector, industry, government, IGOs, the UN. I've always been very envious of the fact that from the air pollution standpoint, Europe has an organization called EMEP and CLARTEP. I don't know if you're aware, most of you are probably aware of CLARTEP, but this air pollution treaty that has been around for like 30, 40 years already. Obviously, air pollution, you need to have countries working together. And I think this One Health approach is very important, like Veronica just mentioned about communication, get countries talking with each other, having a lot of cooperation. I think one area where the UN could really help the countries is the trying to organize these kind of maybe agencies or forums where countries that are on the same boat regarding the fact of like air pollution, same one atmosphere kind of a sector where they can get, talking with each other. I know the United States, Canada, and Mexico are sort of talking, and Europe, like I mentioned, has ClearTap, but any other region, I don't really see anybody really communicating regarding these kind of issues. And I think the UN could really make some headway into having these countries talking with each other. For example, like in East Asia, it would be wonderful if we could have Japan, China, and Korea, and Mongolia, these countries talking about the similar air pollution problem and the health effects that come from these kind of air pollution problems.
Thank you very much, Professor. And at the end, very short question for Benjamin. How can we develop zoonotic risk reduction strategies without damaging local economies? It's possible or not?
Well, we hope it's possible. This is definitely what we're trying to do. But so the issue that is that we just need more research. So there is no one solution that fits all. It's we will have a lot of different solutions on the table, and that will be provided by science. Now, after that, so the goal is really to have, and I think it's something very important, and this is where the different political levels can help. It's really a debate about which kind of society we want. So we know that we will need to make some compromise. There will be some trade-off between economic activities, environmental protection, and zoonosis emergence. In addition to all the other kind of consequences of human activities like pollution, climate change, and so on and so forth. So we will have to make, at some point, difficult choices. But I think it's not the goal of science to make this choice. The goal of science is to provide what are the different solutions on the table, and then after that's a really discussion of the society and the debate that each society should embrace.
Thank you, Benjamin. Any more questions? Maybe young representative?
Yes.
Don't be shy.
Thank you. So in One Health approach, it is important to include youth. And we have one good example from Croatia, where we, through concept SDG ambassadors, have started dialogue between youth and ministries. But I would like to address these questions to all panelists, like how else young people can be included in this very important topic in concept of One Health approach. Is there like any more suggestions how youth can be even more engaged in these kind of topics?
Would like to answer to our young colleague?
Maybe I will, if I can start on that one. As part of our role this year, one of the things we're advocating is to have a youth component of the World Food Summit. And that would, with the topic of the One Health we want from the perspective of youth. And I think that's really to look at the, let's say, the game-changing solutions that youth might bring to making the application of One Health tangible, real, and applicable where they are. But I mean, at a very practical level, why are we not bringing One Health, the environment, really into education at a much earlier level, connecting the need to understand how the health around you matters for your long-term health, that of your community, that of your parents, that of your village, that of your world, and really bringing things in as educational tools that will actually ensure that the next generations really are ones that actually take care of their local environment as well as take care of their health. And I think there are many new ways and tools of engagement that could help us to do that, linking, in other words, our One Health vision with that of also building education and in rural community and urban communities. Thank you.
Thank you, Keith. If there is any question, any more questions?
I would be happy if it's possible to add a few lines also from our perspective, which is indeed the one of offering several strands of, I would say, concrete cooperation. So first of all, full support. We have also written black and white in all our policy paper, and we will implement that. We want to see more in education on the nexus between health and environment in curricula. So of course, this is something that requires the goodwill also of our member states to uptake the idea, but we will do the maximum from our side to spread this approach. When I look, for example, at the specific strand of implementation of the Zero Pollution Action Plan, you know that we will have a specific zero pollution stakeholder platform that will have to cooperate with our European Youth Forum, which is already an existing structure in the EU that brings together a number of NGOs, mainly led by very young people. The Green Week that has just passed, and you see the image behind me, has been entirely devoted to engage on zero pollution. I was so happy to see the Hackathon initiative, for example, which is an initiative bringing together children from 12 up to 18, devising very practical solutions in very short time span to cut pollution in several areas. We have agendas of beach cleanup, which are taking place in certain time frame throughout the EU to remediate damages made by pollution, which is an agenda of engagement with young people and citizens as such. So plenty of different things. And I would say out of all, the one that I like the most is citizens, young citizens engagement, also to ask for their rights. This is what is driving very much also our political agenda. Thank you.
Thank you. Thank you to all panelists for excellent presentations, for your fruitful discussions. And now I would like to invite Mr. Georgi Chukandashvili to give us closing remarks. Georgi is the head of the Health Division at National Center for Diseases Control and Public Health in Georgia, as well as invited professor at Tbilisi State University. So, Georgi, please.
Hi, everyone. It is a great honor to be a part of today's meeting. This is one thing that I needed to highlight, but I very much enjoy the interaction between all of those key stakeholders that you represent here. And I would just like to conclude that the COVID-19 pandemic has challenged public health systems globally. And to prevent the future pandemics, we need to improve environmental and wildlife protection by routine surveillance in animals and improvement of early warning systems. One Health approach understands that diseases occur with the complex biological, ecological, economic, and political systems. And it tries to understand how they work individually, but also collectively, how they interact with each other, how they affect and depend on one another. One Health consists of animal health, veterinary health, and the environment, as we know. But unfortunately, the latter is evidently frequently neglected. And unfortunately, Georgia is also not an exclusion here. And this has been proved by a lot of international publications and reports. The environmental sector has a broad scope of interests, and it includes topics such as air pollution, chemicals in the soil, invasive species, climate change, deforestation, and the impact of industries such as mining. This was also mentioned today. Fluctuations of temperature and humidity can affect bacterial ecosystems. And another matter of concern is the fact that effects of air pollution appear to be influenced by global warming and climate change, and rising greenhouse gas levels are pushing up temperature, which can then change the seasonality and distribution of many infectious diseases worldwide. Climate change threatens ecological integrity of living systems by altering life cycle of pathogens, vectors, and reservoirs. interfering with the harmony between the species in particular habitat. And we have had a lot of examples of this occurring both in Georgia and internationally. It is of great importance to ensure adequate involvement of human, animal, and environmental sectors in this One Health triad to monitor and evaluate systems, to improve the strategic direction and coordination of One Health networks locally, regionally, and globally, to enhance management of pollution, urban planning, greening of cities, for improving public health and addressing climate concerns, sustainability, and livability. The success of One Health thus depends on, as it was mentioned many times this evening where I live, and in many places morning, but it was stated that it depends on coordinated inter and transdisciplinary multi-stakeholder partnerships and efforts that are based on international and national policies that put the advancement of One Health ahead of interests of individual sectors. And I would like to thank you once more for your attention. I feel very privileged to be a part of today's meeting, and I thank you all. Thank you.
Thank you very much all for the participation and for valuable contribution. As I previously said, One Health approach is a very hot and target topic and will be for sure more visible in the future and important in the time we have ahead. So thank you again, and goodbye all from Zagreb, from Croatia, and of course, good luck to the England, and we support England game. Bye.
Thank you very much.
Thank you. Bye.
Thank you. Bye.
Bye-bye.
Thank you so
Bye-bye.
much.
Thank you.
Bye.
Thank
Thank
you.
you very
It's
much.
been a pleasure.